I feel so lucky to be here and lucky to be a part of the Friends of Evidence, the group that Frank Farrow and Lee Shore and Josh Sparrow pulled together probably about a year and a half ago or so, right? And what I love about it, and I think even the first time we got together, I looked around the room, and first of all, I mean, super, super bright people like Tony and others, but just coming from different disciplines, and as was articulated this morning, a bridge group that's bringing together the studiers and the doers, the academics, the researchers, the evaluators, with the practitioners, and even with the folks, as we have up here, who have the resources to make a difference. And I think that's so unusual, and again, very lucky to be a part of that. So I think the central question for today that we've heard over and over again is how do we make better use of data to achieve outcomes, and particularly at scale? And I love the fact that question, can we do it at scale, has come up over and over and over again. I'm going to maybe twist the question a little bit differently and suggest that maybe what unifies all of us is that whether or not we're studiers or doers or somewhere in between, is that we're really trying to get real about how social change happens. We're really trying to get real about how social change happens. And my lens through that, I've been doing what I've been doing for about 14 years, working with organizations individually and collectively on strategies for social change, and particularly over the last 4 or 5 years, spending most of my time in this arena of researching and writing and actually consulting on collective impact efforts. And if you're involved in these efforts and you're involved on the ground, you can't but not confront this question of how do we get real about how social change happens. And just a couple of things that I've noticed that I heard over and over again this morning that I would just like to highlight as we move into this panel that I've learned from working in collective impact is that first is it really requires a shift in perspective. And there are a couple of shifts in perspective, again, that we heard this morning over and over again. The first is moving from thinking about individual organizations and individual programs to thinking about things from a systems level. We're in a world where we're all talking about, systems change. But often there's not a lot of systems thinking applied by many of the players, whether it's the practitioners, whether it's the studiers, the academics, the researchers, whether or not it's the folks who have the resources. And that is a big, huge shift that I think we're all still getting very used to. And it's not that systems thinking and a systems orientation and, if you're a doctor moving from thinking about how you just advise, you're advising a family on a child and how they can, address avoiding obesity, and you want them to, eat better, and you advise them on that. But of course, you don't control the food systems and whether or not they have access to fresh food, et cetera. We're all sort of getting more into that. And we heard a number of times this morning in health, I think there are, clearly a movement to really embracing population health, and that it takes you outside of the hospital. And so we're all waking up to, really getting serious about how do we take a systems orientation. And in the collective impact work, that sort of manifests itself in sort of asking this question of what if each of us could know what all of us know? What if each of us could know what all of us know? And one of the things that's just profoundly affected me, and I feel privileged to be part of a number of different collective impact initiatives, is when you see that happen around the table. And it's really quite simple. It's really bringing people who look at the same issue from all different perspectives together and just watching what happens. And it's not rocket science. It's real practical stuff. But it's amazing that, what if each of us could know what all of us know? And so this shift to systems, I think, is a really, how do we actually get real about engaging in that? The second is a focus on relationships. And I loved both Tony's perspectives on this, but also, we heard it over and over again from the panel of practitioners, whether or not it was Maria from LIFT, or Sandra from Northside Achievement Zone, or Dr. Rob from Cincinnati Hospital, Children's Hospital, this focus on relationships. And I think the challenge there is that we don't have a lot of great methodologies or even experience with thinking about relationships as a metric. Part of what I'm trying to do is, as we do our work more and more, is really understand how you function in sort of systems of complexity. And one of my mentors is Brenda Zimmerman, who's co-author of Getting to Maybe How the World Has Changed. Maybe some of you have read that and done lots and lots of other stuff. But Brenda talks about the unit of analysis in complex systems is the relationship between organizations and individuals. And I love that. The unit of analysis is the relationship between organizations and individuals. But how good are we at actually measuring that? And Tony didn't talk about it this morning, but Tony and his colleagues have done some great work coming up with this notion of relational trust. And to me, it's like one of the first times I've seen somebody really take on this question of how can we think about the unit of analysis being relationships. And again, that's a shift in perspective. That's a real shift in perspective. But anybody who does this work, you'll hear it over and over again. Well, it's really relationships that matter, right? Well, if it's really relationships that matter, let's figure out how we actually measure them, right? And include that, and not just say, I don't know, Tony, at one point, one of the phrases on your slide was willfully avoid, And I think there's a bit of willful avoidance with relationships as part of the evidence base. And so how do we think about that? And the third is, over and over again, the notion of continuous improvement and a shift in perspective from thinking, moving from thinking about sort of measurement in an episodic and retrospective way to measurement in a continuous and forward-looking way. And so whether or not it's rapid feedback cycles, there's lots of different terms, but that notion is, again, a shift in perspective for us as we think about this. And I'll layer on sort of a second shift in perspective related to this continuous improvement, and that's when we think about the notion of doing this work collectively. Because it's not only individual organizational continuous improvement that we're talking about here, but collective continuous improvement. And one of the ways I like to talk about collective impact is that what makes it unique is not necessarily sort of the continuous improvement approach, but it's collective seeing, collective learning, collective doing. And so we think about sort of layering on a new orientation, what's still a new orientation for many folks doing this work of continuous improvement. And we talk about doing it collectively. We've just raised the degree of difficulty pretty darn high, right? Really pretty high in terms of what we're all talking about here today if we're practically going to do this stuff. And yet what's so cool for me is we heard some really exciting examples this morning of real people taking a more inclusive approach to evidence and doing it in a continuous improvement way and making positive and consistent progress at scale. They were actually doing it. That's so cool. And yet, here we are today, a fairly self-selected group sitting here with some great examples, and we know that they are much more the exception than the rule, right? Much more the exception than the rule. And so that's why we want to shift this afternoon to, okay, if we want to take this from, some great episodic examples that were super inspiring that we heard about this morning, to thinking about how do we make this systemic in the systems change towards more inclusive evidence that is used in a continuous improvement way. How do we actually do that? And we know the answer is not going to come out by the end of today, but we have to have this conversation. We have to have this conversation, and we have to take some actions. And we know that even when we take those actions in the spirit of continuous improvement, they are themselves going to be, not the answer, but we just got to start. And so that's where we're going to shift this afternoon. We have three awesome panelists who know a thing about data and evidence and continuous improvement. And I'm just going to introduce the three of you guys briefly, and then we'll get right to it in terms of Q&A. We'll start with Jim on the end here. Jim Shelton is the Deputy Secretary at the U.S. Department of Education.
Good.
What's that? Did I get that right?
Yeah, that was good.
Okay, good. Yeah. All right. Well, we got to say, I mean, Jim's been doing this work a while, and you know, I mean, he was previously at the department in the Office of Innovation Improvement, so he's worked in promised neighborhoods. He's, you know, been involved with I3 and the great initiative right now around boys and men of color, something that Jim's very involved in. So Jim's been very much at the center of thinking about this work for a number of years. And one of his previous lives, he worked in philanthropy at the Gates Foundation and has some other interesting things that I won't necessarily share in terms of his career. So we're not. So Maura Jawar is, did I get that right?
Mona.
Mona, I'm sorry. I've
all
got
good.
my glasses. Mona, I am so sorry about that. Is evaluation manager for the California Endowment, and she's responsible for the Foundation's evaluation design, planning, and organizational learning in support of achieving impact, and worked in city government prior to that. And Shelley Metzenbaum is currently president of the Voker Alliance, and between 2009 and 2013, Shelley served as associate director of performance and personnel management at OMB, where she was responsible for setting and implementing the Obama administration's approach to improving performance of federal programs. And worked previously to that at the EPA and also in state government, and she's a recognized leader in the field of public sector performance management and measurement. So three great perspectives as we think about how do we start to put in place maybe an infrastructure that does what we're talking about here today. And so I think a process here, I'll start with a little bit of a quick kickoff question for each of our three panelists based on their experiences and their work. And then we'll sort of have a little bit of back and forth, and then we'll open it up. So Jim, you know, you've got some terrific experiences at your belt as a leader in the Department of Education, and as I mentioned before, involved in a lot of the place-based work that the department is doing. It'd be great to hear from you how your thinking has evolved in terms of, you know, being rigorous about results on the one hand and looking at data, but also thinking about how you can include this notion of adaptation and continuous improvement and recognition of, you know, what's working, what's not, and sort of evolving things over time.
Sure. So, one, I'm excited to be here with you, and I have to, again, say I am amazed. It is cold as heck in here, and you guys seem to be doing just fine. I mean, seriously. So, I mean, actually, I had a great conversation with Anand as we were waiting and listening to Hillary talk about some of the lessons learned we've had from the work we've done around the place-based initiatives, specifically promised neighborhoods. I mean, the whole notion that you could start to, in place, take a much more rigorous view of how you're going to drive specific outcomes, to get agreement on those outcomes in a local community, have multiple parties in those communities come together around what those outcomes are going to be, build the systems and tools and resources to begin able to track those and the leading indicators to tell you whether making progress on them, and then have a set of decision-making and governance mechanisms that will allow you to select programs that are meant to move those outcomes and then scale them. That's heck complicated. And what we are seeing is that, especially the people that have been on the bleeding edge of this work, I know you all heard from one of our shining stars this morning, but it's not always that easy. And so the reality is that the tools and resources to support this work are not in place, and we're not quite inventing them fast enough to support the work. So what that means is that we need to be investing in the tools and resources and methodologies of this work as much as we are the programmatic elements of what we're trying to get done, the change we're trying to see in the communities or against these specific outcomes that we're focused on. And I'll stop there and let others
Well,
go.
maybe just a quick follow-up question. So you know, how is the Department of Education and is the Department of Education thinking about investing in the tools and resources?
Sure. So we were very fortunate that even before we got into it, some of the foundations came together to start to fund the technical assistance along with some of the infrastructure that would get done. Out of that came the Promised Neighborhoods Institute. It then rolled into the partnership with cssp. And we continue to invest in that TA infrastructure through contracts and vehicles of that sort. We're also working across agencies and across the administration on the tools and resources for place-based work, trying to actually make sure that we have a policy context that deals with some of the things that are trickiest, like, for example, data, so that we can do these things that are meant to break down silos. Kind of hard to do if you don't have the policy that allows you to do so or the systems to support that work. So we're trying to fund both the creation of those systems and to give guidance on the frameworks that let people do that as well. We're also trying to make sure that the tools and resources that are developed in the field, that we're funding the work of the distribution and dissemination of those things. And what we're finding is that in order for it to work well, traditional dissemination strategies are largely ineffective. And those who are actually doing the work should correct me when I say something wrong. But what we're finding is that it takes intensive support to train people to have these shifts in perspectives that you just described, where they're able to begin to think about what it means to really drive for results, what it is to build these systems, both the systems in terms of hard technical systems and the systems in terms of how we actually work together and build those relationships and have set processes and protocols that still stand when our interpersonal relationships fail. You know, one of the things you learn working in government is when the systems are broken, the relationships become really important. And one of the things you also learn is that a failure of systems can put a real strain on relationships. So we need to be focused on how we build both of those, the capital in both areas. And then I think the last thing I would say is that we're trying to invest our own intellectual capital about how we do this work both within agencies and across agencies. It is a different way of thinking about what the work of government is. I think it is a smarter way of thinking about what the work of government is. And as we think about the role of the federal government in enabling state and local governments to do more of this along with their community partners, it's a new thing for us, and we're having to invest in our own capacity to do so. Naja Dabi's back there. She'll be able to talk much better than I can about this, and she'd probably love to, because I'm not going to be here for long.
Great. Well, yeah, I mean, you said a number of things that I'm sure folks would love to follow up on, so we'll come back to some of those. But Mona, Hillary talked a bit about sort of the role of private philanthropy. Obviously, you are in private philanthropy is in a bit of a privileged position, not having to be elected, et cetera. And would love to, California Endowment, my experience is watching what California Endowment is doing is you really are, what I'm observing is a foundation who is trying to get really real about how social change happens, as challenging as that is. And love to hear you talk about sort of how, in your role as evaluation manager there, the endowment is thinking about sort of taking this more inclusive approach to evidence in communities. And it would also probably be great to maybe even summarize a little bit of the approach that the foundation's taking these days.
Sure. First off, let me say that our Chief Learning Officer, Jim Ketty, was interested in being here. He sends his regrets, and hopefully I will do justice to our work. I want to start off by sharing a couple quick thoughts, and that really revolves around how TCE is interested in using evidence and what we consider sources of evidence. And it's really predicated on this idea that we are interested in promoting learning, like we've been talking about today. That we want to be able to inform decision-making that we do within the foundation. We want to be able to influence decision-making that's happening on the ground. And we also want to make sure that we're fostering change and iterating as we go. And that's definitely a central tenet to how we do our work. It's also informed by really recognizing this fact that developing evidence for community-based change really requires thinking differently about who gets to generate evidence, who gets to use evidence. And that's really something that we're doing a lot of thinking about. Our partners we have a ton of different partners on the ground who are embedded in community. We have program managers that are also embedded in community. And so we're really interested in thinking about ways in which we can utilize the power of that thinking, given that these folks, our program managers and our partners, are using information on a daily basis to make hard choices, right? To make choices about strategies, programs, resource allocation. And so that's really helping us as a foundation to really move in this direction of being a co-learner with our partners and with folks on the ground. And that really is important to us because we want to make sure that we're creating space that sufficiently allows for folks who are doing the work to take part in the process of creating knowledge that are in the process of using that information. So that's really part of where we're coming from with our orientation. And we're trying to do this type of work in a couple specific ways that Hillary actually started talking about. We are trying to use both formal and informal feedback loops. We're interested in helping to encourage our sites that we're working with to actually operationalize this concept of being learning communities, and we can talk a little bit more about that later. We're using both quantitative as well as qualitative data. And we're also trying to be open to different approaches to collecting information, right? And using approaches such as developmental evaluation, so that we're really trying to lift up lessons about our work as our work is unfolding. So that is definitely a part and parcel of the work that we're trying to do. I think it's also worth noting that we've also tried to organize ourselves a little bit differently. I mentioned Jim Keddy, who's our Chief Learning Officer, and his position really is one that blends in this function of research and evaluation. We used to have 2 directors of research and evaluation, and we've moved into a position that Jim occupies that is about being a Chief Learning Officer that I think really codifies this move into intentional learning. So with that, I think I should probably provide a little bit of background for folks who might not be so familiar with the endowment's work. So it's worth knowing that we're in year 4 of a 10-year commitment to a strategy that we call Building Healthy Communities. And we're working at a statewide level and take a statewide policy approach. And then we're also coupling that work with a place-based approach where we're working in 14 specific communities across the state. It's important to know that the communities that we're working with are culturally and racially diverse. The folks that we're working with, half of our residents are non-English speaking, and a majority of our residents come from communities of color. And I think it's also important to know that throughout our work, we have a really strong commitment to equity and inclusion, to ensuring that we're creating communities where children are safe, healthy, and ready to learn. And this really means that we're not shying away from some tough issues that we've been talking about today, tough issues that are complicated and complex, that are imbued with structural racism, that make our work really challenging and equally hard to measure. And so it's also worth knowing that both locally and statewide, we're working within 3 specific campaigns. Health Happens in Schools, where we're working on issues such as trying to provide emotional and social supports to students. Health Happens with Prevention, where we're looking at the implementation of the Affordable Care Act. And Health Happens in Neighborhoods, that really is a wide-ranging set of issues that we focus on, from land use to safety. So the last thing I think I'll mention about our work is that in order to move these 3 campaigns, we're also really trying to focus on building the capacity and strengthening the capacity that already exists within communities that we're working with around 3 specific drivers of change. And so those areas are pretty broad, but we're interested in looking at youth leadership and supporting youth leadership, building resident power, fostering collaboration, making sure that we're leveraging partnerships within our sites, and really looking to make sure that we're changing the narrative of what it takes to create health. And so that's really an overarching view of the work that we're doing. And as you can tell, it's complicated. As I said, it's extremely complex. And so when thinking about the world of evidence, we're really interested in trying to look at various sources of evidence, various methods that help us produce evidence that works from the ground up, so that we're really looking at demonstrating change both at the community level, at the regional level, and at the state level. So I think I'll leave
Can
it
you
there.
talk a little bit about how the endowment is thinking about bringing resident voice into this process?
Yeah, that's great. There's lots of different ways I could talk about that. One in which I will share is around the planning process that we went through really involved developing what became, I think, a mixed bag of experiences around developing logic models within our sites. And so what we asked for folks to do is we created a template that one of our consultants helped to develop that looked at different components of the logic modeling process. And we asked for folks to really think about the results and the outcomes that we wanted to see achieved at the end of this 10-year commitment. And that process was really driven by the sites locally. And folks had to really decide how they were going to organize themselves in terms of how they would develop a cohesive vision around their plan for how this community change effort would work locally in the sites. So that was definitely one way in which we were really creating space for folks to take action. Although we were asking folks to think really specifically about outcomes that we had already predetermined. What was really interesting about that process, despite some of the challenge, I think there were some sites that were definitely into logic modeling, and there were other sites that were just like, what are you guys doing? This is crazy making. But I should say that there were plenty of sites who were interested in the process. One thing that emerged through that process was a prioritization of something that wasn't on our radar that is now a huge focus of our work, and that's in focusing on the social and emotional supports that students need in school and restorative justice practices. It was something that wasn't on our radar when we started building healthy communities. It was something that really emerged through the logic modeling process, and is something that when reviewing the logic models really came to the surface, that really put it on the foundation's radar, and from there we started to run with it. So I think that example really demonstrates the power of when we're listening to folks who are doing the work, when we're actually creating a space for that voice to come to bear, and we're actually listening, that we can actually make space for different approaches.
Great. Well, again, a lot to follow up on there, but we'll come back to it. So Shelley, you're now outside of government, but you have a career in government and 4 important years with the Obama administration, and you've been a leader in terms of bringing performance monitoring and management thinking into the government, and OMB has been one of the critical players in terms of sort of getting serious about this and an advocate for RCTs, and we heard some perspectives on RCTs this morning, but I'd love to hear you talk about sort of your thoughts on how OMB and perhaps even you in general have evolved your thinking related to this.
Happy to do that, and I'll also tell you a little bit about the Volcker Alliance and how we're trying to do this going forward. But let me start by talking, just sort of trying to be clear about the questions I think evaluation and performance measurement are trying to answer, because I don't think we're explicit enough about that, and we need to get more explicit, because I think this whole evolution of much more useful performance and evidence-based management will really evolve if we really discipline ourselves to ask those questions and then answer them. So I think we started with a question of, does it work? And we talked about that this morning. But actually we didn't. We talked about the what works clearinghouses. But I think the first question that people tend to think about evaluations answering, as conflicted with performance measurement in some ways, but is, does it work? And that's not a wrong question to ask. If you're taking an action, you want to know if it had the sort of impact you expect it to have. But and you don't want to do what doesn't work. So I always think about the hand washing things, signs that we see. Does that actually make you change your behavior and wash your hands? Then there's the next question, which is the what works. And the what works clearinghouses, and we talked again, I said this morning, but it's like, okay, I want to be able to see what I can pick off the shelf and sort of, know what works or not. So should I use this drug for this kind of patient in this situation? So the what works clearinghouses might be helpful in understanding what treatments I might want to choose from, what practices. That is just skimming the surface, and unfortunately, I think it has been where the evaluation conversation has started and pretty much stopped for a while, and now I think it's moving on. So I think one of the questions we need performance measurement, perhaps evaluation, to answer is what problems need attention? So really to help us think strategically, where should we be focusing our priorities? As well as what opportunities should we be pursuing? So again, the measurement can be helpful there in thinking about it and finding patterns, in finding prevalence of problems, and as I said, opportunities. So measurement for that value. So as we collect measurements, as we build data systems, really thinking about how am I going to use it for that purpose. But the one that I really think gets very actionable and that we're all starting to grapple with, whether we're talking about at the community level, we're talking about the individual organizational level. If you're a nonprofit, we talked earlier today about groups of organizations, or the government level. The first thing I think is the question of what is it I am trying to accomplish? And for that, you ought to be able to set fairly clear goals. And if you can't, you need to be able to push yourself to say, why aren't we doing it? So when I was in government, when the Obama administration came in, the first thing we wanted to do is get folks to say, what are you trying to accomplish? And where are you going to have priority goals that you're going to try and accomplish immediately? Before you get your new legislation passed, before you get your new appropriation, what are you going to try and accomplish? But then the second question is, how are you going to know if you're making progress along the way? You've got to think about that. You've got to be able to answer it. And then the question that too often got left off the shelf was, how can I do better? We've been talking about getting better at getting better. That's what we need the data for, to find what works so we can do more of that, to find what doesn't so we can do drill downs. And I really thank Tony for his fantastic example of performance measurement in practice, where you both look at the distributions and realize, even though my average is doing better and outperforming other averages, my distribution is quite different, and I both have problems I need to identify and understand their root causes, but also positive outliers, the bright spots, the positive deviants, whoever you're quoting, Atul Gawande, who wrote this great book, Better, years ago. If you haven't read it, read it. But let me mention that I think we also have to get better along multiple dimensions. One is these outcomes. The other is return on spending. So once we've found effective practices, really trying to figure out how do you get them to, how can you get more with your available funding? Or how can you cut costs and reallocate elsewhere? The quality of interaction with the people you're interacting with. So in government, it's the people you serve. It may be other parts of government. A lot of times it's state and local governments or grantees. How do you improve the quality of the interaction? And again, in government, and build understanding of what it is you're trying to do, why, and how. There's a fairness issue you might want to get better at. There's accountability in terms of being clear about what it is you're trying to accomplish. So there are all these dimensions of better, and I think the measurement systems need to help us do that. So in the government, I think there is a transition. You saw it in New York City with crime on CompStat, computerized statistics. You go back to the National Highway Traffic Safety Administration with traffic fatalities. You see some of the work the Department of Education is doing right now with turning around the lowest performing schools, which required them first to define what that meant, and then to identify which ones were, and then to find practices to turn things around, where you're setting clear goals, you're trying to figure out if you're making progress along the way, and then you are you're putting in place mechanisms, data-rich discussions, data-rich reviews, where you're engaging those who are involved to figure out, and I was really struck by Tony's models, where you're asking what's working so we can do more of it, what's not working. And in this, and I'd say to your question, John, one of the things that really struck me when I came into the federal government that was really, really surprising was the divide between the performance measurement people and the evaluation people. And then there were the program managers over there who are like, not sure where they fit in this whole thing. And we've got to bridge that divide. We've got to bridge the divide between program operations and performance measurement and evaluation, and then the budgeting process. And make it so that you're not getting penalized if you don't make targets, but rather you're getting penalized if you haven't figured out how you're going to make progress along the way. And I think it's a whole new way of thinking about accountability and performance budgeting and things like that. That's a great buzz term, but gets off on the wrong track. The other divide, I think, is that researcher-practitioner divide. And we need to figure out how to integrate measured trials into program operations. So we've been working a little bit with, I was at APAM, the Public Policy and Management folks, did a great panel with some Head Start, the Minnesota Head Start director and others who were really talking about how do we start integrating measured trials into the operations of programs. And I think that's one of the big challenges we have. And in order to do that, we need to realize that measurement, management evaluations are not a gotcha game, but they're an engagement tool. And that we need to use the goals, the measurement, the data, and the discussions on strategy to communicate and engage and enlist expertise. And as you were talking about, figure out what the right priorities are. It's a very, very powerful tool, which leaves me at the thing that most perplexes me, I think still, is we have a framework in the federal government, which is called the Government Performance and Results Modernization Act, that actually lays out and makes mandatory the requirement to set goals, measure performance, use the data to manage with, decide where you want evaluations, and it informs budgeting processes. And yet, it's seen as this too often as this sort of burdensome exercise rather than this power tool that you can use to bring about change. So I think there's an opportunity here, and I'm hoping people can seize that opportunity. The people in this room can think about how they work with government agencies to sort of say, how can we be helpful here in framing the goals, doing bottoms up as well as what the top-down support is needed, and also where we need sort of incentives to keep it going, recognizing that incentives poorly structured tend to backfire. So you probably don't want to link the measurement to the attainment of goals, but rather to the production of data so that you're learning and you're building a continuous learning and improvement community. And then I'll just stop and say, and the Volcker Alliance is all about trying to catalyze more of this kind of work, taking on systemic problems. We've been talking about systemic problems where we think we can make a difference, bringing the right people and actions and knowledge together. And performance, impact, and innovation is one of those areas where we're really going to be focusing. And in fact, Pradeep Nair is the program director for us, and he's here joining me today.
Great, thank you. Good. Well, I know one of the questions we had sort of touched on in the prep for this was your perspectives related to why you think that framework within government is not being more embraced. I'm curious here.
So I think one of the reasons there's a fear that the goals there's a fear that the goals and the targets will be used for gotcha. If you didn't meet the targets, then you're going to get attacked.
Well-founded fear.
A well-founded fear.
That's right.
I think it's a well-founded fear, and at the same time, I think folks who recognize the fear and run with it have been able to deal with missed targets if they bring the folks together around the table. That said, having worked at the Environmental Protection Agency for 4 years, I don't think that's always possible at the federal level. But I've also seen, the regional administrator of EPA set a goal that the Charles River would be swimmable in 10 years, miss the target, and have everybody cheering him on because he had every year reported on progress, the next set of strategies, et cetera, and had bipartisan folks at the press conference, not as bipartisan as you can get in Massachusetts. But I've seen lots of folks miss targets, but if they were transparent about it, it works. Yeah. At the same time, I don't want to be naive. This is a town that loves target practice, and goals are targets.
Yeah, good, great. Well, again, a lot to follow up on there. So questions from the audience? I think we're still on time. Patty, right in the middle. We have a microphone for Patty.
Great discussion, very stimulating, and
Can you switch microphones for a second?
If you could imagine that you're a consultant to a collective impact effort, and the organizations within that collectivity has contracts with government, state, local, federal government, and organizations are being held to individual levels of performance. And you're consulting with them about how they might best negotiate with government to enhance collective goals, enhance collective goal setting. How do you think about performance within a collectivity, and how do you manage government in discussing those kinds of goals?
Collective goals, collective performance. How do you think about
This is purely hypothetical, right?
In your new career.
Yeah. So, I mean, the interesting thing about it is that what we've tried to do is foster an environment where you call your program officer and they organize a meeting where you talk about what you're learning, but also that there are a series of convenings that you, as a consultant that happens to be working with one of many organizations that are probably doing similar work, come together to talk about how the framework needs to be changed to accommodate what's actually happening in the field versus what was designed at the very beginning. So since you asked the question, I'm assuming that is not the experience that you think that many people have been having. And so it causes me to have to reflect on why it wouldn't be as simple as picking up the phone and calling your program officer.
Yeah, I guess it really depends also on what the law says, et cetera. There's a lot of myth that goes on around. There are some laws. I don't know if there's more people who are more expert on workforce development than I am, but the new law has linked incentives and bonuses to measurement. But in most cases, that doesn't necessarily exist. So if I were a consultant, I'd be trying to negotiate so that you expected me to set a stretch target based on benchmarks and historic trends. Then I would commit to giving you data on a regular basis and to analyzing it and asking you as the grantor to give me the evidence you're finding and for me to give you the evidence I'm finding back and to be part of a learning community. That's what I push for.
Great, thank you. Question over here.
Hi. I wanted to mention two ideas that were prompted really, particularly by Shelley's, but also everybody else's, and see whether they make sense to you as next steps. So one is, Shelley said that the first step of learning is defining the problem. And I think in terms of California Endowment, you described an example where you learned a new problem that you didn't know before. And I guess I'm a big believer that descriptive data is incredibly important in this learning process, and that actually the academic and evaluation communities can sometimes be part of the problem and not valuing that sufficiently and looking for cause and outcomes as the only interesting thing. So my example used to be when I was in the child welfare agency in the district, everybody told me whatever happened to abuse and neglect reports was seasonal. Whatever it was, go up, go down, it's seasonal, and that actually turned out not to be true and not a useful description, but there are many examples. So the first question would be, do you think encouraging a much greater focus on just understanding who and what and the nature of the problem would be useful? The second thing is to the point that Shelley made most vividly, but also others, that a big obstacle to a learning culture in the public sector, not just in Washington, is the consequences of blame. That learning is very hard in a world where blame can topple you. And so acknowledging failure is hard, crisis is hard. And what I guess I would suggest there is that learning about how skillful leaders manage that is in itself useful. I mean, I'm always very struck that people who are good in state environments, in child welfare agencies or in welfare agencies, or the ones I know best, have thought about how you engage people. They too experience bad luck. I mean, I'm not sure anybody's stream of success can go more than 3 to 5 years, and so if you really want this to last, it's also about succession. But who's good at managing that? I mean, one example, then I'll be interested in your comments. I watched the CDC and Ebola, and I think I am really impressed with Tom Friedman's ability to say he didn't do it right, and here's what needs to happen next. And to me, that's the central example of learning. Whether that will keep him his job or not, who knows? And so that question of how do we learn about what people do and what it takes to persist, I think that's another thing I'd put on the agenda.
I'm really glad you brought that up, particularly in light of the fact that I think oftentimes that leadership, even within foundations, can be stronger. And I think we have a long ways to go there too, particularly around the fact that oftentimes when looking at a portfolio of work, an individual program manager or program officer's role is really looked at differently depending on the performance of their grantees, right? So that's part of the issue, and that's part of what we need to grapple with, at least within the foundation world, in terms of thinking about how we shift perspectives to actually create a culture of learning, right? And this is going to be, I think, some really tough work for us, because it means that we have to look differently at our work. We have to look differently at what it means to have results that are positive and negative, and being open to everything that means, right? And if we can't do that institutionally as a foundation, if we can't set that example for how we do that work and have those conversations and are real about what it is that we're learning, not learning, or what we've done completely wrong, then why would we expect that from our grantees and our partners on the ground? There's really, we need to hold ourselves accountable to that same premise.
Yeah. Let me also pick up, Olivia, I want to make a distinction. I was saying we need data to figure out what problems need attention, which I think is what you're saying. So that is the descriptive piece and what opportunities there are. That's different than if I'm trying to manage something, to be clear about what it is I'm trying to accomplish and whether there are 1, 2, 3, or 12 key performance indicators. And then there are also probably indicators I want to watch because they're risks, and I want to watch out for them. So I do think that it's very important to do the descriptive piece, and in fact, we've paid far too little attention. That's part of what I was trying to get at, is we really want to see the patterns of variations. It's why I thought Tony's thing today was so helpful. It was such a vivid, illustration of what you need to sort of bring out from the data. Going back to your other thing in terms of, I totally agree with you. One of the things the Volcker Alliance, and someone had asked a question about this before, that we want to think about is what should we be teaching in our schools that will help people understand who go into government or other public service organizations, how do you do this well? Because right now, when you're taught statistics in schools, you take those outliers and you toss them out rather than ask if there's a story in them. But if I look at Bill Bratton, and I'm fascinated watching him communicate on the goals and the measurement, in part because he's the guy who's the police chief in New York City, he was in LA, and he really communicates a lot. And he's balancing a lot because he's using the public media to communicate to the troops as well. So he's got this mayor who was hired on stop and frisk because the predecessor had done too much. They hadn't been managing the unwanted incidents, the side effects of police abuse. So it was the crime, but they forgot to watch the other piece of the picture that really made a difference. But watching the way he communicates this stuff, not always consistently. He's got a very tough thing, but I think I watch him to see the lessons we can all learn. And I think you're right, it is part of what this community, to do better, should be trying to study and teach each other.
Right there, and then we'll come here.
Yes, my name is Andy Munoz, and I work with Youth Thrive, which is a strength-based initiative for older youth as a part of cssp. I know still when we think about return on investment or the data that's documenting, people are still almost always running to dollars. And clearly, forming and sustaining social capital is equally or maybe even more important. What's the opportunity for creating documentation that focuses on kinds and types of social capital and perhaps looks more like developmental case studies as a way of documenting our learning and forward movement.
I'll let you do that.
Well, the thought that's coming to my mind is I think it's about asking the question of, are we interested in what's happening right now, or are we interested in the long-term perspective, right? And if we're interested in long-term sustainability, then the question that you're posing is an appropriate one in terms of thinking about how we look at what is our leave behind, ultimately, and being able to appropriately find methods in which we can capture that story. And using case studies, I think, would be a terrific way to do that, because you're able to then really capture the nuance of the work that's happening on the ground. And so the question to me is really about, are we interested in sustainability? Are we interested in taking that long view of the work?
Good. Thank you. Senator here.
Hi, my name is Peter York with Algorithm, which is we're creating networks of organizations to do this kind of learning. My question is, as I start to look at the question posed by the session heading, which is what is required to support a full spectrum of evidence? In my experience, a lot of the organizations we're talking about are the organizations that are in let's say the top 20% of the sector. And these organizations are actually having to evaluate, research, and learn with independent call-outs to do different things. Private foundations are funding them, government's funding them, some are place-based, so they have a whole pool of requests. So to come to the question, what is required to support a full spectrum of evidence? We almost have two classes of organizations in our sector. One that are doing huge amounts of work, learning, evaluating, researching, and quite often with different questions being asked by many parties. So there's a huge amount of effort to support what is not a coordinated effort in my experience, but is a request coming independently from all other their funders. And then there's a huge class of organizations that are also working within communities that aren't necessarily always on the radar screens, that are pretty much research, data, and evaluation bereft, that are actually 80% of the sector. So when we talk about the full spectrum of evidence, how and what are you all seeing in the recent past, because I'm not sure in the long past we have it, and moving forward, can we begin to really talk about the issues of the amount of evidence gathering, learning, and processes that are being put on communities that are in all of your radar screens, and the total lack thereof for the 80% that aren't?
Yeah. So, I mean, I'll start on this, and I'd love for others to who know more about what they're talking about to jump in. The thing that will cause this effort to fail is if we are not able to figure out how to create an infrastructure that allows earlier stage organizations and organizations without as many resources to participate in the process of building evidence about their practices and their efficacy. And what that is going to require is a rethinking of the methodologies and the systems and tools that we use to build evidence. And it's going to require us to think very differently about how we get comfortable with a true spectrum of evidence, so that we can begin to graduate people up to higher levels of investment in more and more rigorous models of gathering evidence. And it's going to require that we push ourselves to think of new and creative ways to identify patterns in data and data collection that allow us the flexibility not to have identified all the questions on the front end. Now, you see people doing really interesting work in trying to figure these questions out, but we're going to have to work a lot faster to support the demands of the kind of systems that we say we want around the use of evidence in our decision making, and especially around resource allocation decisions.
So one thing I always like to encourage organizations to do is to return data to the data suppliers with value added through analysis. And I think that maybe we ought to start there in some ways and sort of say, okay, what's going to help the school run the school better? What's going to help the teacher teach in the classroom better, et cetera? And then start to try and figure out how to tap new technologies. I couldn't agree with you more about that there's the spectrum of data you need, and a lot of it is sort of the operational stuff, but then you need the outcomes piece. And then there's the spectrum of capacity that you were talking about. So I know, like in Massachusetts, there's a group that called the New England StatNet that I helped start years ago, where what I was trying to get them to benchmark across the cities that were doing stat things to, compare public works or whatever, and said, can we just compare the change over time? And the guy who's running it now said, Shelley, you're missing the point. Some of my guys don't even know how many cars they have, so we had to go in and create the fleet inventory. So you're right, we have very different levels of capacity, and I think as we're trying to build this infrastructure that's continuous learning and improvement, we need to think, can we build tools, especially in a world where people are so used to carrying around their own data, generating equipment in their pockets. Let's figure out how to build these tools in different ways.
And I would add that in thinking about how we build those tools, particularly in the 20% of the communities that you were mentioning, Pete, needs to be really closely connected to the data needs that folks have on the ground. I think that all too often foundations come in with our interest in the data that we want to collect, and we need to be paying more attention to the questions that communities really want to answer, and I think that's the most ideal entry point to that 20%. I think what I was also hearing in your question is underneath it is really a call to foundations and to funders alike to really think about how we do collective impact work or use principles of collective impact and thinking about how we can actually really reduce the amount of burden on our grantees so that we can really start to work together and think through, if we're working on similar and with similar communities, how can we actually align what we're asking folks to collect in a more cohesive way so that we minimize that burden. So your point was well taken.
Question? Yes. Up here in front.
Thank you, panel. My name's Ron Glass, and I'm the director of the University of California system-wide center called the Center for Collaborative Research for an Equitable California. And we are sort of orthogonal to a lot of these sets of issues. So we find that the universities do not prepare people, researchers, to work with communities to help them generate researchable questions, to help them do research on their own practices. I think very often the communities that are most impacted by the inequities have discovered through their own need to survive the inequities that they suffer from, that they have developed a variety of strategies for approaching that, but that researchers and foundations and the government pay attention to what's been published in the literature rather than the organic knowledge that has been generated in these communities as they confront these problems. So the researchers in universities don't know how to work with communities and generate research. They actually get reprimanded at the universities because they get told that that's not research, that's advocacy. The communities themselves are suspicious of researchers because researchers have come in so often and studied the community to promote their own careers, and no change has happened in the communities. And the communities themselves don't know very well how to generate and use evidence in their own practices. So, I'm wondering, how do we create capacity both among researchers and among community leaders to collaborate and do research and generate different kinds of evidence to help us understand what's going on in these communities and help us understand how better to solve problems.
Good.
Okay, I'll start. A couple thoughts. In terms of thinking about capacity and how we prepare people differently, I think there's a lot that we can learn from this emerging developmental evaluation field in terms of the type of skill set that folks need to be nimble, to be flexible, and to have like their ear to the ground a little bit more closely. And I think when I think of skill sets that evaluators particularly could benefit from right now, that's the skill set that I see as really useful, particularly as we think about working really closely with communities that have been disenfranchised, both within the community as a whole and have been overstudied, and there is this huge distrust. I think part of that process is also about retraining ourselves, whether it be if you sit in a foundation or if you sit in the practitioner world, around the type of relationships that can benefit programmatic work, and thinking about when you bring in evaluators and the role that evaluators can play in your work. And to me, that's part of the re-education process, because the earlier that you get to work with an evaluator as you're developing your work on the ground, the better that process is going to be in terms of being able to think about outcomes and how you measure them in a way that makes sense to the work that you're doing. So I really think of the type of capacity that we need to build is not only at the institutional level, like within schools as we're training folks as researchers and evaluators, but I think there's some training that we need to do as a field as a whole, so that we see the value of evaluation coming in much sooner than it's often introduced, and introducing that relationship so that evaluation and programmatic work can really work hand in hand early on.
So I'll just build on that really quickly. I mean, I think that what is really clear is that communities come to very quickly understand the benefit of focusing on results, and that communities that go through the discipline process of defining results that they want to pursue see immediate benefit in that. The questions of then what is the logic model that supports that, and then what are the systems and methodologies I have to be willing to go through in order to support an evaluation of the work I'm going to do, as opposed to how am I just going to do the work to get this result, has diminishing returns relative to what they have to spend they think they spend their time on day to day. And so the question becomes for us, how do we basically build the capacity in communities to actually get more disciplined about identifying and focusing on those results? And then how do we continue to reduce the burden of the work that they need to do to actually support the evaluations and systems, methodologies and systems that we want to use to evaluate whether the work that they're doing is being effective? I'm not saying that the things that we are asking them to do today are not helping them actually be more effective. I'm saying that we talk about the return to them of going through the amount of capacity building required to participate as active members of the evaluation team, if you will, is too high. And so we have to find ways to reduce that burden and cost.
I do think this is a question worth having a further conversation with. If anybody else wants to talk about it, we would like to, because the incentives for researchers, if you're looking for your first appointment, you know, there's one kind of very narrow paper you need to write. If you're looking for tenure, you need to get into a disciplinary journal. If you're post-tenure, then hopefully you're interested, but by that time you've probably gotten set in your mindset. And so it is one of those questions we're trying to figure out. If you're working for one of the consulting firms, then you're really responding to the way an RFP has been written, which may not be the right way to write the RFP. So I do think, if this is to your point, is we need to start to build capacity in this area, and then I think we start with the coalition of the willing, and we figure out how to pave a path and hope we can then create the motivators for others to follow.
So I know there are a bunch of questions, but I think we probably need to bring this to a close. Is that right, Frank? Yeah, okay. So we'll be around for Q&A. I know Jim has to run off, but so for close, maybe let me ask the three of you a question, and I'll warn you in advance. Shelley, I'm going to start with you, then we'll go to Jim, and then we'll go to Mon. So the question is this. We're sort of talking about how do we collectively, as a society, you know, put in place the sort of scale opportunity for more inclusive use of evidence and continuous improvement. You all were answering questions in some respects on behalf of your institutions, but I'd like to ask you to think about this at a personal level. You know, over the next 1, 2, 3, 4 years, where are you most passionate about sort of contributing to this advancement yourself? You know, what from your standpoint is what you want to do? And so I'll start with you because you've actually sort of stepped out of government and you've made a choice into a particular organization. So I imagine that that probably has to do a bit with what you want to spend your time on.
Well, I sometimes introduce myself as a performance measurement and management evangelist. And I don't even say performance management only because in government, 90% of the people think that's about performance appraisals and bonuses. And so we all have a language. Whatever field we come from, we all have a language problem. I think I have seen in so many instances, whether it's traffic fatalities or crime reduction or Indian crime reduction, or what they're doing at the education department to really use the data to figure out how to help people get better. This is such a powerful way of bringing about change. And so then the question is, what are the levers that we can push on that will make the biggest difference? And I think one is trying to figure out how we engage with the government so that we can actually help them scale, and how can those outside constructively do that? And secondly, how do we get the schools that are preparing people to go into government or to work with government, how do we get them to really be much more constructive forces? And I'm optimistic about that because there are precedents in other areas like the medical profession.
Great, thanks, Shelley. Jim?
So I've become fixated on the notion that the most efficient use of a taxpayer's dollar is to pay for the outcome, getting the outcome that you wanted. Like, if I only pay you when I get the outcome that I wanted, then that's the best deal I can get. So we can't do that, obviously. But the next best thing then is that you pay for the probability of an outcome. And that's where the evidence stuff comes in. And once you start to get a system of incentives and you have a bunch of people who are willing to work that way, it says, you know, pay me one thing if I get an outcome that you want, and maybe I can't get nothing, but pay me a lot less if I can't get that outcome. And we have dollars that flow that way, not just like little tiny programs, which I love the programs that we have, but they're tiny relative to the big dollars that we put out. I think things begin to shift much more quickly. I tend to think about how do we create a market for evidence? And then all of a sudden, when you have a market for evidence, you have lots of people who want to invest in new methodologies and tools and resources producing evidence much more quickly, much more effectively, much more cost effectively. And I see the people squirming already, which is wonderful. I love that. But I think that there is an opportunity to really blow open the space and the incentives for people who are not paying attention right now to how we do this for the sector to do it, and to cause our dollars, both public and philanthropic, to flow very differently, and to create a new set of capabilities over the next decade that we can only imagine today.
Great, thanks, Jim.
It's tough to follow. Well, what gets me personally excited actually about some of the work that we're doing right now, I mentioned, is around learning communities and trying to foster learning communities within our 14 sites. And to me, I think this is a really great opportunity for not only obviously the foundation, but folks that we're working with on the ground, namely because of the fact that we're really asking sites to think about the fact that we're generating a lot of data, but what do we do with it? How do we interpret it? What do we mean by it? How can we use it? And it's really, I think, a way for sites to determine that on their own. And to me, that's incredibly exciting and incredibly powerful, and speaks to how we want folks to really invest in evidence and invest in evaluation and learning. And to me, that's an incredibly exciting prospect. And I'll leave you with one example of what I think of as an innovation that's occurring in one of our sites in Long Beach, where we put out this call for, we're interested in our sites functioning in this way as learning communities, and they took up the call by doing something really straightforward, by saying, we have a lot of different issues that we're working on as a community. There's a vast amount of knowledge that we don't know about, so let's get folks together who want to learn about these issues. And so they've taken on a number of different books to actually read together in community, right? And the last one was the new Jim Crow. And it was perfect timing because on the ballot on our last initiative was Prop 47 that tied in so well to what folks were already reading about. And so in conversation with our program manager in Long Beach, what she really raised to me is the fact that, you know, this was an idea that came out of this learning community concept that folks wanted to exchange information and really dig into an issue. And it really became a galvanizing moment for some folks who were not typically engaged in the Building Healthy Communities work to actually engage in a very concrete way around a proposition that came on the ballot that connected to the work that they were talking about. And to me, that was just a really powerful moment of thinking about, all right, this is learning in action, right? This is providing space for community to connect around issues they care about and want to learn about and think through how to do work in different ways. So to me, that gets me really excited.
Great. Well, a lot of insights, some great perspectives, and even some provocation. So please join me in thanking our three panelists.